Henry? Okay, Henry. Henry,
Okay,
can you talk?
can you hear me? Can you hear me now?
Yes.
Okay. I just wanted to add a few things. Number one, I want to say thank you very much for hosting and making this discussion from all over, from Dr. Kerandi and Bogonko, Mr. Helen and Lina and, all brothers and sisters. I fear, like my brother Nyaveri, pastor was saying, this COVID has actually changed the way of worship. The way people used to go to church, be together, know one another, what's happening here and there, offer some, local support. It's not the same anymore because now we are not doing any visitation. And I'm also seeing a bit of a cultural, some people fear to say that they are sick, even when actually they are sick. And I feel that way is not protecting everybody, because myself, my wife, we all tested positive. I've been to hospital. I was there for some days. I came home. I have had people describe, different symptoms, which is true. The symptoms that my wife went through are not exactly the same like the ones I went through myself. The goodness I know is that we are brothers and sisters who are praying for one another, and it encourages us all to know that, yes, even though there's no medication, God has not left us. God is still with us. And by and by, I am seeing very good progress in healing. There are so many, if my brothers and sisters, whoever is sick, could be able to tell others that, yes, they are sick, it prevents a lot of spreading. Because I know that we meet some people, even though you don't come to my house, there are those who are still at work. You meet at work, you share things at work, and the temp. When I ask those who go to work, how are you tested that you are not sick? Most of them, they say, oh, they only test the temperature, and if your temperature is not high, then you're allowed to work. But the truth is, the temperature is not the only way of testing whether somebody's, is positive. Or if someone is sick, there are some body aches, there is headache, some people are vomiting, some people are, but they don't have the temperature. So there are many who are coming to work, spreading it, but because they haven't tested, because their temperature is not high, they are still out there. So what I can encourage our brothers and sisters is that let us share the message by telling others, when you are sick, when you come up and find that you are positive, yes, tell others to know, so that way you protect yourself and you're protecting others. But there's always healing. There's nothing to say that, oh, now that if you have contracted corona, you are going to die. It's not true. There are so many people who have overcome it. And of course, the fear is we have our grandparents living with us now. We have our older generation living with us. So if we are not careful, my fear is this thing is going to transition to these elderly, members in our families. And that is where I fear that, yes, when that time comes, we need to be prepared that, yes, maybe bad things will happen out of it.
Okay. Thank you very much for Henry for sharing that. in Caleb.
No,
Yes, Caleb.
do something.
Caleb.
Dr. Ari,
Yes, yes. Yeah. Can you talk?
well, I want to thank you so much for hosting such a useful forum for us to share as a community. Like those who've talked before me, you know, we represent, you know, us as immigrants, we represent the highest percentage in healthcare, and we are the people who are exposed and affected and also infected the most. And in fact, more than a month ago, I was exposed at my work. I am an RN at a senior living facility. I got exposed and I have a young family. I have a 7-year-old and a wife. We live in an apartment. And then we were told to quarantine. So I had to quarantine in one room, and I was so scared that I've infected my family. It was so challenging, but Dr. Mandy and the rest were in touch with me. They were able to, we didn't have shopping in the house, but Mandy and other friends were able to provide for us. So this thing has affected so many, and you had Yamoheri and the family, you know. I went to visit him, and I realized the wife was affected, and 2 days later, he was telling me he's been infected too. So this thing is affecting so many people, and as a community, we need to, you know, advise each other on how to protect ourselves. One thing I realized that one of us did talk about is having 2, 3, 4 jobs. You move from one job to another, and these long-term care facilities, they don't have the PPEs that Dr. Bogonko and Dr. Kirandi said that we need to use. They are told to, you know, to reuse the masks. They don't have the gowns, you know, they don't have face shields. You know, my wife works in healthcare. I had to bring a mask from my workplace for her to use. So it is terrible. I don't know what we need to do to empower our people so that we can protect them, because like Henry said, we have brought our families here, our mothers, our fathers, and if they get this thing, then we are doomed as a community.
Okay. Thank you very much, Caleb, for coming out, like talking about it. Some people think it's something like leprosy you don't want to talk about. It's good that you have come up, and it's only good that we have our people. Now, my question is, what can we do so that even if we are talking about the flattening the curve for the rest of the population, how can we do to flatten the curve among the immigrant community, the African community? Anybody will say how we can
maybe before we go to the flattening the curve is one thing that I did was as I assembled a medical team to give me counsel on how to proceed. But what this group here needs to do, you also need to identify a team that can help people to cope emotionally. Because one thing I have realized is that this thing has drained people mentally and emotionally. People are very much stressed. You could think that COVID is is the real thing, but stress is destroying more lives and bringing people down even more. So we also need to identify from here a team of people whom we can give an opportunity to address our communities on issues of fear, on issues of stress management, on issues of post-COVID.
Okay.
And the fear that surrounds those who are COVID positive and have recovered, that we are able to move forward together, because we have to reopen life and move on. Thank you.
Thank you very much, Pastor. Okay. Anybody? We don't have to be only speakers. Anybody who's in the audience, if you want to give a suggestion, the solutions, the way forward.
Lena is lifting her hand.
Commented something very good, that we need a medical team to help. That's a very good idea.
Lena wants to say something.
Okay.
She's muted.
Okay.
Who?
I think I'm unmuted now.
You can unmute yourself. Okay.
So I think I'm unmuted. Well, I want to say thank you for the opportunity to invite me here. But everybody here can agree that even just focusing on the immigrant community in the diaspora is very important, because we are not going to save the world out there unless we save ourselves here.
Yeah.
And knowing that we are carrying the load of not only our families here in Minnesota or like in the diaspora, but also back home, it's important to start, like charity begins at home, or like Mother Teresa said, if you want to change the world, go home and love your family. So it starts with our families. At the beginning of March, I did a live and I did a post, and I was sharing the communities, avoid large gatherings. People were texting me, are you saying stop church? I am a public health nurse in the state of Minnesota. So my job is to educate the public, but also not only in promoting wellness, but also preventing illnesses. So I was sharing it from that platform to make sure. So I think the government is not doing enough, because irregularities from CDCs, hospitals and facilities don't have uniform standards. So you and I, like Dr. Ondimu said, it's our responsibility to say it starts with me. What is going to protect me? What is going to protect my family? If I have to quit that job, at least I can get a job. But if I die, I will not have a job. So what is feasible and what works for me right now? Number two, Pastor Leakey talked about physical, mental, spiritual, and financial health. All those things have to be addressed and must be addressed. Otherwise, we are not holistic. We are all affected, and we're going to be affected. I shared something the other day about the lack of cultural competence or cultural humility in the whole of this thing. The CDC guidelines were okay for a normal majority. They were not okay for the poor. They were not okay for cultural groups. They were not okay for undocumented workers. The stimulus package, the same thing. The economical impact, not the same. So I think it's our responsibility to go back to myself. How do I help me so I can help you? How do I protect me so I can protect you? And as a public, then we say, okay, reach out to someone that you know can support you emotionally or spiritually, like a pastor. Seek out a counselor if you know one that can actually help you with the emotional roller coaster of the stress and anxiety. Elder Nyamokeri said it well. There are people who have survived this because it's not a death sentence to a lot of people. But the majority who are older and have other diseases before the COVID are at a higher risk of dying. So those are the ones that we must think about as protecting as well. Even the children are affected of not being in school or seeing the elderly people getting sick or their parents. So I think the biggest thing for me as I head off is to say thank you for bringing this in, but bringing it to a cultural perspective. How are the poor affected, who are us? How are the immigrants affected, who are us? How are the Black people affected, that's us? But what are the resources that we can have? Mwanyagetinge has a task force. We raised a few funds. For those within the Twin Cities who belong to Mwanyagetinge community, they can reach out to any of us, Pastor Leakey. We are all part of task force. We can help a few needs of food here and there. The cities have resources for food. They're giving grants to small communities. Reach out to your communities and find out who's been given money to support you. There's a lot of money, like the Liberian community in Brooklyn Park got money to support the West African community. So I think it's knowing where the resources are, reaching out and sharing this. And when you see someone post something in your groups, whether it's WhatsApp, Telegram, the local forums, church groups, don't ignore it, because the education we've gathered or achieved in this country is to help us survive. It's a survival method. So don't ignore, oh, that's just Omandi talking, oh, that's just Pastor Leakey, oh, that's just Lena. Listen to what we are sharing, because we already have that exposure, and maybe we've been given a resource that is willing to support other people. So my ask is to pray that, yes, thank you for sharing those who've come out and said, and yes, there's a lot of people recovering, but this is not over yet. believe me, there's another wave coming. And like malaria, we've never found a vaccine for malaria. There's never been a cure for the flu. So that's the same way as from a public health standpoint, we're gonna have to continue the social distancing, the washing our hands, the universal precautions that we've been doing to protect ourselves so we can be there in the future to protect our families. That's just my take.
Okay, thank you so much. We are coming to an end, and I know Dr. Kirandi was was going back to hospital, so I don't know if he has left, but if he has a comment, we have 10 minutes to wind up. But Dr. Kirandi, you want to say something before you go? You have gone because I know you were going somewhere.
Okay, yeah, yes. I raised my hand up. Let me lower it down. Now, to echo on what Lynn said and Pastor Leakey, there are few things we have to look at. What is the immediate thing we need to do? What is the short term and the long term things we need to do? There is a lot of anxiety, a lot of panic, confusion, fear, depression, which is going around about this COVID-19. How do we address this at this time? I am very happy with our two brothers, Kev, I think, and Nyamukeri, who have come forward to share their experience. Can we encourage all others who are either recovering, who are actually gotten the disease? Like today, I actually called someone who I know got the disease to come forward and share with others, even making a telephone call, prayer with somebody will actually improve your immunity. Hope is one thing which improves immunity to care for us. That is the immediate one we need to do. We need to exercise. We are not telling our people exercise. Do it in your house. Charm. Do deep breathing. Eat vegetables and greens, the reds, the greens, rather than the meat and the sugar. This is the time when people should realize how important it is for nutrition, how important is it for exercise, how important it is to rest. Keva said, people have been moving to 3 jobs. We never get rest. We never let our body to rest, to recover, to recharge. We need to do that. That is the immediate things we need to do with that. Short term, let's get those ones who have suffered to come forward, give us the experiences, what they did, what was good, so that we can share with others. The long term, there is a lot which is coming up about social, with economic, mental illness, education. Our children, they have been home for so long. They are going to be affected. Some of them are having problems. Are we going to graduate? We have our own Mukida, which some of us don't join to know what it does. Such groups, we need to join such groups to help us. Lina, who are in the nursing field, who are in the leadership. We have our nurses who are in the long-term facilities, CNS, TMEs. Are they in an association which can help them so that they can advocate to get the right working tools in where they are working? That is very important because we fear retaliation and we don't do anything. The Minnesota Nursing Association, you remember, I think was it in a line where they said they are not going to work without the PPEs. And that's what they did. Are our people going to do that? Or they fear retaliation? How can they be guided? Although I know they will fear that the money we are getting is the one we are sending back home, is the mortgage and all that. How can we have in a way that there is no retaliation to them and still they can continue working? Those are the things we should look at. As Pastor Leakey said, we can look back and say, what groups do we join? Actually, we do have groups around, but it's only that we, especially Kenyans, especially the Omogusi, I think they are the majority who are in this group now. We don't take things serious. We take things for granted. When people call us for meetings, we don't go. When people call us to join such and such, we don't do. When people call us ask Dr. Ndimo Nyachaya about your economic impact on what is like in the capital market. We don't do, we kind of push away things because we have never been affected in a way to see we need those. But now that we have been affected, it's a call to us now to realize that things which people say can actually come. They have come, we have seen them, and we can learn from this, and it will help us. Thank you. That's the comment I wanted to make.
Thank you, Dr. Karandi. Yeah, I know if you want to leave, I know you had a schedule to go, but anybody with a comment?
I'm scheduled to go to, so. I want to add on what Dr. Karandi just said.
Yes,
just because you mentioned Mukida, we have a graduation online. We've been having, for the last 18 years, Mukida has been having a graduation gala for those who have graduated from high school. We recognize those and give scholarships. I want to make sure that we all know, go out, we're going to have social distancing. We'll be having that online. And those who will be attending online, and if you're graduating or you have somebody graduating from high school to college, or they're still in college, we'll be giving a scholarship of up to $1,000 that Mukida will be paying tuition. So watch out for that. Number two, most importantly, pocket book is most critical. And I said this earlier on. I said, what does this mean to me? Because mostly people ask, hey, what does this mean to me? It's something out there. It's not for me. People are dying, people are sick. We all know that. We copy and paste. What I want to make sure is this. Everybody knows that before it comes to you, like my brother Moki said, gets to a neighbor. Rise up, drive your car, do some shopping for somebody who is sick at home. That's number one. Help them out. Do some shopping. Number two, hold off from investing in Kenya. Invest in yourself first. Don't send money to Kenya first. I know we are sending money. I know. I understand. I have family. They depend on me. But first, you have to be alive before you save those. Remember when you're trying out, they tell you put a mask on. You have to put this mask on now. Very critical. Number three, and finally, I want to stop this here. I want to stop here. Make sure that even those who are working in healthcare, we all know we have secure jobs. Not anymore, because the senior living houses, people are dying in numbers. Save some money for yourself. Those jobs that we totally depended on are not anymore. Please go slow. It's very critical. Thank you. And I want to thank you, Dr. Mani, for hosting this. I really thank you for that.
Okay.
Dr.
Thank you very much. Now I have those people who raise hands. Helen, then Kefa, then Okari. Helen.
Yeah, I need to leave. I just want to say one thing.
Yeah.
Because everybody said too many comments. Yeah, we have the common goal to do well. But this is the only thing I'm gonna advise any health worker: stand up for yourself. Okay. What do I mean by stand up for yourself? And I'm gonna give my own example because I'm working in healthcare. When I went to work, they would, it looks like when I get there, because I work as a contract in some hospital. When I get to the hospital, the worker at Atlanta Hospital, they had a different equipment, equipment than I did. Because I'm a dialysis nurse, I'm a contractor, so they did not provide me. They did not provide. Can you guys hear me?
Yeah.
Yes. Okay. Yeah, they did not provide me with the proper equipment. So I stand up for myself because this is what I said. I told them, even though I'm a contractor, I'm still working for the company here. If something happened to me in this facility, it's going to be Atlanta Hospital problem. It's not going to be my company that sent me there. So always remember, wherever you work, nursing home, health, group home, hospital, stand up for yourself. Do not be afraid that you're going to lose your job. It's your right to get what you need to be protected and protect your family. That's what I needed to say.
Thank you. Next, Kefa.
Yeah, Dr. Mandi, this is Kefa Tiso. I very much enjoyed listening to you, and I'm sure you've noticed that I've done something similar also, but I wanted to add something to the discussion. First, to commend you for doing this. We don't do enough community education, and we have always relied on outside professionals, when in fact we have enough people in our own community that actually can do some of this work. So congratulations for doing it.
Thank you.
Number two is, you know, this crisis is like World War I, World War II, the Great Depression. Big crises like these ones come to change the standing order. It brings new opportunities, and it actually does away with certain things that we were used to. So, for example, you might see that the way the Busi have been doing funerals has actually changed, because we're one of the communities that actually spends on funerals. So I know that after this crisis, every one of us can see that we need to change the way we do things. And therefore, I would ask every one of us to reflect on what you need to change at the individual level. And I think even financially, this has already been mentioned. These are things that we need to do. In order for this message to go to the community, don't depend on Dr. Mandi. Everybody does not listen to Dr. Mandi, does not listen to Dr. Tiso, does not listen to Ondimu or anybody. But there is somebody in your sphere of influence that listens to you. So it's your responsibility also to inform those that listen to you. So there are people who listen to me, there are some who don't. So that's actually the way it is. So every one of us has a responsibility to educate the community. Don't put it off to somebody else to reach the people that you know it's your job and your responsibility to reach. Number three, we are talking of physical distancing, not social distancing. You can still meet virtually on Zoom. Human beings do not do well when they are isolated from one another. In fact, it brings a lot of issues. So just because you are physically isolating does not mean that we are socially isolating as well. Those are two different things. Make sure you don't confuse them. And very quickly here, also pay attention to the education opportunities that have come about because of these things. A lot of schools are now online, universities are online. So while you're educating your kids and these other things, please also take a moment to educate yourself and prepare for the new jobs that are coming down the road. I have to tell you that I study some of these things a lot. There are some jobs actually and some companies, unfortunately, that are not coming back from this crisis. A lot of them have started filing bankruptcies because they're not coming back. There will be no market for them when the economy begins to reopen. So pay attention to what is happening in the economy at large and make sure that you start preparing yourself for the new economy that actually is beginning to come, which actually has been forced on us by this crisis. I know a lot of big companies, by the way, that have been refusing to allow people to work from home. Now they were forced to allow people to work from home. And I know a couple of them that actually have said, hey, we didn't know this thing works so well. Why do we need to pay for big offices when we can actually just give people money to have high-speed internet access to work just as efficiently from home? Also ask yourself, have you discovered something about how you work because of this crisis? Maybe you're one of the people that actually is finding out that you're more efficient working from home rather than working at the office, and start thinking of some of the opportunities that actually you can take advantage of. So Dr. Mandi, if you don't mind, I'll mention that I've also done 2 shows that are similar, and we can make those resources available to the community just because we want to make sure that our people are informed and that actually they avoid some of the negative consequences of this crisis. Thank you.
Thank you, Dr. Tiso. I know you have done a good job. I've seen the work you have done, and I really appreciate that you took time to join here. Let's continue to do that and post. So next is Dr. Kari. You raised up the hand.
So
Dr.
thank
Kari.
you. Yeah, thank you. Thank you, Dr. Madi. Thank you for hosting this. And I want to thank the panelists. I think they did a good job, especially that they are very resourceful members of our community that we truly respect, and we need their voices at this time. So I think Professor Otiso read my mind. I was just going to share precisely what I shared in the meetings that we had 2 days ago. I quite frankly enjoyed the conversation, but I just an observation of what I think we can do going forward, particularly if we're going to use technology to our success. I noticed that we had 6 participants who covered different areas. In the future, I would suggest that we try to be a bit more specific on issues that are needed mostly in society, in our community. For example, today, I like the 2 doctors and the nurses, they're giving us a medical perspective. I think that's very, very important. And I think it's good also that they had data that backed the argument. I think that makes more sense when we're dealing with such a serious issue. And then going forward, I'd suggest another forum that we try to do a mind mapping of our community, take advantage of the moment so that we address specific issues that we really need to address here. For example, issues such as education. I understand people have talked about healthcare, but what are we doing from an education perspective? Professor Tiso is there. I'm here. We're experiencing different things in the classrooms as we transition to online formative. What are the parents doing at home to educate the kids? Because that's an important area that we really need to pay attention very closely. And we have experts in the community who can come on here with clear data to make good arguments for us. And then we can also move forward and say, look, the African culture has it that we have to meet in person, but realistically speaking, things have changed and they're changing the long term. How are we going to use social media, just as a platform such as this, to continue to be engaged? Can we say, for example, every other Friday or Saturday, let's have a topical issue that we can discuss on? That way, our community is engaged. I noticed here that we had about 55 people in attendance. Professor Tiso's meeting the other day had 70, and another before then was about 89. That's good. It tells us that our community is really engaged, and that in fact that we're not meeting in person. It does not mean we can't meet face to face. Let's look at family, for example. Let's have Pastor Like and other pastors. Let's have a topic specifically about family. What do we do? And do some research so that by the time we come on here, you have good data that supports your claims. Let's have students. I mean, let's have 1 or 2, 3 of our students in the community. I mean, I had some of my students in class sharing their experiences on what they're going through. It was interesting to listen to what the students were saying. How about we hear the voices of our students in our community? Because quite frankly, that's our future, and we really need to invest in that as well.
Okay. Yeah, thank you very much. That's a very good observation. Yeah, Dr. We we are planning also for education and like mental health issues. We will have another meeting. We didn't want to concentrate so many topics on this one, so that is on the pipeline. We will do that. Thank you. Thank you for the observation. Okay. Any other comment? Anybody who wants to? Is Neri in? Neri.
Hello, can you hear me?
Yes.
Yeah, my name is Nelly Torori. I just want to thank you, Dr. Mani, and all the panelists that have shared more information around the COVID-19 and how that is affecting us as the African immigrant, and all the others that have also given their input. A lot has been discussed, and I think what I would have commented, I think the very last speaker, Okari, has just talked about. It's good to talk about the general, but also to start now, when you start narrowing down topics that are very specific. I know Dr. Madi had reached about you. My passion is in mental health. I talked about that. Yeah. And anytime when we talk about even, when we talk about the medical health, you cannot afford to talk about the overall, the holistic approach of the whole person. So that's where we bring in the mental well-being. Of course, even our pastors, when they talk about our spiritual health. So my suggestion also would be, I know we've talked a lot about COVID-19, what are the symptoms, how is it affecting us as a community? And I like the way we are approaching it and saying, we need to get to a point where we really have to normalize our conversation around COVID-19. I'm not suggesting we minimize, but we normalize it. The reason why most people don't even want to come forward is because of we tend to stigmatize the COVID-19 to be a death sentence. Actually, it's just like we have people that have suffered the flu and others die from it. So until we start normalizing COVID-19, talk about what those symptoms are, and with good health, as Dr. Kirandi talked about, actually using the new start, you will get better. Many folks that we know in our community, not even just local in Minnesota, even other states, we got hundreds of our people that have recovered from COVID-19. So as a community, once we start really normalizing, just sharing about, oh, this is what I did, this is what worked. And one thing also that I really want to mention from a mental health perspective, we've talked about stress. Of course, we know depression, high levels of stress and anxiety, but talk about phobia. We have talked about paranoia. Right now, the way we are approaching it, we are creating a lot of fear, especially within our elderly population. I'll tell you, our elderly who are at home, some of them, they're worried because some of us who are working in the healthcare, we have our parents at home. We are coming from those hospitals where every time you turn on your TV, every social media outlet, we are seeing how many people have been infected and the numbers keep rising. These are the same ones. We are coming back home to our loved ones. What are we bringing in? And then when we talk about who are at risk of COVID-19, we talk about, oh, the elderly are more vulnerable. They're the same ones we've left at home. How are we addressing this with our loved ones at home? Right now, the parents who are at home, they feel something, a headache or having some chills. They think, oh my goodness, I think I got it. We really need to start normalizing our conversation and start to remove this fear that we are bringing in our community instead of reaching to each other. And I really want to commend those that have come forward and talked about what their struggle has been and how they overcame that. And we can do that as a community. Naturally, we are a collective community. I know we talk about social distancing, and Dr. Otiso, I like the way you put it. Actually, I like to also talk about physical distancing, but we still need to keep each other socially because we don't do very well when we isolate or when we keep ourselves afar from each other. We have Zoom. Look at what Dr. Omandi has just done. We've shared a lot through Zoom. We can call each other. We've been doing our worship through Zoom, and I'll tell you the first few weeks, it was a bit awkward, but now it's getting very, very comfortable. It's our new normal now that we look forward to seeing each other every weekend when we are worshiping. So let's try to keep close with one another, checking on each other, because really our mental well-being is paramount. We talk about that and how to approach it. Thank you.
Thank you. We have come and let's have a comment. We would like to end with a prayer, but unless somebody, I don't want to leave and put a comment.
I have a comment, Tom.
Sure. Yeah. Okay, Tom.
Yeah, I wanted to find out for those of us who may have maybe come in contact with someone that you're not very sure whether they have the COVID. I mean, you suspect that maybe you have come into contact with somebody. Do we have a way that we can get tested? How do we go about getting tested just to make sure that you are still safe and you've not contracted it?
Anybody to answer that question? Anybody?
Yeah, I think if you contact Lina Nyamwaya, she can give you contact. My phone has just gone off, but there are contacts that are available, how you can call and do that. So you have Lina's number, you can just shoot you that information. And I will ask that it's posted in Manyagetinge and other forums.
Okay. Now, thank you very much. Let us end. Somebody want?
I wanted to tell Tom, I haven't gone yet. Tom, okay. There are several places, Minnesota designated areas for testing for COVID. One of it is where I work, North Point. We do what we call a drive-through. You don't need to be seen by a doctor. The only things we need to have, all this, you need to have symptoms. But if you think you came into contact with someone who has COVID-19 or coronavirus, you can call, make an appointment, and they will test you through a drive-through. You don't need to be seen. I hope I've answered your question. Also, there are places which, if you go to Minnesota, MDH, Minnesota Medical Health, Department of Health, sorry, you will find areas designated to test for COVID-19.
Okay, thank you very much.
Thank you very much. That's a good enough information.
Okay, let's end here now with Pastor Liki. Can
Hey,
you?
Dr. Mandy. Quick question, Dr. Mandy.
Yes.
Somebody invited me quite late, but I'm asking, are you holding these every Sunday?
No, we are not, but we will plan for another one. There's one which is coming we will announce the date. We have to know the panelists, their schedules first.
All right, let me.
I see. I'll suggest that you bring those people who have been affected, who have come out, like Henry Nyamokeri, so that they can tell us the best practices that they used to get cured or get better.
Hello.
Thank you much.
Okay, good suggestion. We will request them, but you know there are privacy issues unless somebody is willing to come forward, but we request.
Okay, I want to pray.
Yeah.
But before I pray, I want to say thank you so much, Dr. Mandy, for hosting this and those who have participated, either as panelists or in form of comments and advice. We greatly appreciate. I know we do have parents who do not understand English, and sometimes these forums do not give them that opportunity, especially in terms of preaching. So what I do is that every time I preach, I try to translate that sermon into Ekebusi, and I share it in the forum. So if you know people who need sermons in Ekebusi, I have a series from the day COVID started up to today, up to what I preached yesterday. They are all kept and translated into Ekebusi. I do share them to Managatinga sometimes, but utilize those resources. Spiritual food in times like this does help. And please don't assume because you are in Zoom and your parent is there, they have benefited. Sometimes they just watch because they have nothing to do. So let's help them in that regard. Thank you. May God bless you. Let's pray. Our dear Heavenly Father, we are gratified that as a community we can come together and talk about COVID-19, the impacts, the effects, and the solutions and suggestions. We are better off than we were before we sat here. We are much more prepared and much more focused in fighting this invisible enemy. And we thank you for this. We pray that you may bless us. We pray that you may heal those who have been infected. We pray, Lord, that you may give us wisdom on how to mitigate the fear and phobia and anxiety that is out here, and how we can give hope, but most importantly, on how well we can work to effect the CDC guidelines on how to keep safe.
Manene Yeso, iwataponye.